Hello, my name is Desiree, and I'd like to go over my teaching plan for kidney stones. First things first, what are my clear objectives that I want my students to meet? Number one is to identify the physiology of kidneys versus the pathophysiology of kidney stones. I think I would be able to first meet this objective by using a classroom setting where I would be doing a lecture on the pathophysiology and physiology by using resources such as Robbins and Coltrane Pathologic Basis of Disease and Guyton and Hall textbook of medical physiology. This lecturing process could take up to 5 to 10 minutes where I'm teaching my students these objectives. Number two is to identify the signs and symptoms, the treatment, and the tests that we use for kidney stones. The signs and symptoms would include nausea, vomiting, renal colic, hematuria, which is blood tinged urine. There's blood in the urine, a urinary tract infection, frequency, and urgency. By treatment plan will vary with the physician's collaboration. It could be using pain medications such as NSAIDs or other narcotics and waiting for the patient to pass the stone themselves, keeping the patient hydrated, or it can be used by other medical treatments such as using lithotripsy, which helps break the stone, and then a urologist could get involved and use a cystoscopy where he'll go into the ureter and go and retrieve the stone that way as well. And for tests, the golden test for kidney stones is a CT scan. Other tests include abdominal x-ray, a KUB, which is a kidney, ureter, and bladder scan, and other blood samples that we help to identify, such as CBC, which will find bleeding, and serum creatinine and C reactive protein for any inflammation. The third objective would be to demonstrate treatment techniques for patients with kidney stones. So besides the surgical and medical treatment for students who are learning of nursing care for kidney stones, one of our most popular ways of doing interventions would be straining the urine. The patient would collect their urine into a bucket and we would strain it with a small strainer. I would like to teach my students this demonstration by a clinical classroom and using a bucket of water that resembles urine, and also adding sediments or some type of rocks for practice. And not every bucket will have the rocks in them. So I would separate my groups and they would strain and try to identify of passing the stone. This helps in real life clinical situations where I would share my experience that some patients are able to pass the stone on their own. Number four would be for my students to share positive and negative experiences with learning about kidney stones. I feel like it's very important when doing teaching that at the end of the lecture you do ask your students what did they miss, what do they feel that they've learned, and be able to contribute in a clinical setting. Any questions that could be provided to me, or even me sharing my own experience. Now the classroom and clinical learning would be used for sure, the classroom and clinical skills lab. Also evaluation and outcomes. I would like to have a test at the end of my lecture that would have questions such as, who do you think are more prone to having kidney stones? That answer would be that it affects all ages, affects all races, all sexes, more men than women. It could be age range 20 to 49 years old, lack of physical activity, dietary habits, also congenital factors and structural factors of your kidney physiology. Another question would be, what are kidney stones made of? This is very important to know as well. Not every stone is the same. There are stones such as calcium stones that are due to hypercalcemia. You have struvite, or it's called magnesium aluminum phosphate stones. These are created from people who have chronic UTIs and alkalinic urine pH. Then you have uric acid stones. These are created when a patient has high in diet purine, such as meat and fish, and the acidic pH. And then you have cystine stones. This happens with an autosomal recessive gene disorder. And then lastly, drug-induced stones. This is a bit rare, only 1% of population have it, but this is if they are on medications such as guanfacine, sulfa drugs, and atazanir, which is a popular HIV medication. It's very important for students to know what creates the stones. And another question that I would use for my evaluation tool are, what have you learned? What experiences will you take to the clinical experience? Those would be more of an evaluation tool and a comment section in a small paper test. And lastly, two more questions that I would like to add in. A patient eats a large amount of purine, such as meat and fish. What are the who sorry, a patient eats a large amount of purine, such as meat and fish, are at risk for which type of stone? After teaching them about the different variety of stones, that question would be either between cystine stones, uric acid stones, or struvite. The answer would be the uric acid. And then another question would be a true or false. True or false, CT scan is the golden standard for diagnosing kidney stones? And the answer would be true. That would be my evaluation tool would be a small test at the end of the lecture. My links for my objectives and learning experiences and my evaluation will be pulled together by the tests that I give. And the last one are, what questions may I expect from my audience? Questions could be, have I ever encountered a patient with kidney stones? I would say in my 3 years of being a nurse, I've had a handful, and everyone is different. Men's kidney stones, I've had some where the patient would be able to pass a large stone. A large stone would be considered a 7 millimeter and bigger. It's very hard to pass through the ureter. I've had people be able to pass them. Not every patient can. Sometimes that patient would have to go into surgery and get it removed with the urologist. Other questions that my students can possibly ask: does this the kidney stones reoccur in patients, or is it just a one-time situation? Unfortunately, the patient would have to be taught of what created their stones. If it was calcium or if it was uric acid, that patient would have to stay on a diet plan or a regimen to prevent those kidney stones. More like, once you have kidney stones, you have to have more awareness of it and talk with your doctor to set a plan to prevent. It's always about prevention, but it's not always guaranteed that they will not have another kidney stone again. I think my students would be able to question me on experience, and then any other questions I'll be able to answer for them. My references will be down below of what I used, and thank you very much.